Hello and welcome to Facebook Live. My name is Dennis Leonard, President of Delta Dental of Massachusetts, and I'm joined here with Dr. David Lustbader from South Shore Oral Surgery, as well as immediate past President of the Massachusetts Dental Society. David, welcome.
Thank you for having me.
And you look very sharp as always.
Thank you, sir.
Excellent, excellent suit. This is part of a new show that we're entitling Pearls of Wisdom. And Delta Dental is proud to sponsor this show. We'll be doing this once a month on topics that affect the oral health community. And the first one we're doing is on opioids. As you all know, opioids have dominated the news, and many people will call it an epidemic. And before we get started, I just wanted to reiterate a few notes here, a few facts about it before we delve into the situation. In 2016, there were 2,149 opioid-related deaths in Massachusetts. Last year, opioid deaths were down by 6%. In 2017, only about 20% of opioid-related deaths were related to prescription opioids, which is really good news. And over the past few years, that has been trending down. So certainly good news, but a lot more room for improvement in Massachusetts. David, some initial thoughts?
Well, I think all levels of government recognize this as a true public health emergency and a public health crisis. And it's in every state, it's in every city, it's in every town. There are 65,000 deaths a year in the United States related to opioid overdose. And that is clearly not sustainable as a country. It's clearly not sustainable in this state. Every death is one too many. And so there have to be a multifaceted approach to get those numbers down. And in fact, that is what is occurring.
In Massachusetts, in particular, I must give credit to the Massachusetts Dental Society and the leadership, you as the immediate past president, of making significant progress here. And the ADA just released some guidelines. Tell us a little bit about that and the progress that was already made in Massachusetts.
Right. Well, I'm proud to say Massachusetts was ahead of the curve and ahead of the ADA guidelines. The Mass Dental Society worked together with the Governor's Council, came together with the Mass Medical Society and other stakeholders, and we were really key players in implementing a law, the new law that's taken effect in Massachusetts. The ADA guidelines, in fact, mimic a lot of what's being done in Massachusetts. Specifically, we are limiting prescription opioids to a 7-day supply as an initial prescription. Refills would require a face-to-face encounter. Partial prescriptions are allowed, which is something new. In addition, there's the prescription monitoring program, so you can monitor if multiple providers are prescribing for a patient. And this, in addition, overall education for patients and their caregivers as to the wise use of opioid prescriptions.
That's great news, and it's great to see that the mass dental community is leading the way nationally. I think some of the misconceptions people have about dentists in general are that all dentists are prescribing opioids frequently, when in actuality that really isn't the case. Talk to me about who are the dentists, the specialties that are prescribing, and a little bit more. Give us some more feedback on that.
By and large, I think most of the dental community does not prescribe opioids. General dentists in routine general practice really wouldn't need opioid prescriptions. Most of those procedures that they might do could be controlled with things like Motrin or Tylenol very effectively. But there are specialties such as mine, such as oral and maxillofacial surgery or periodontology that do require a little bit more pain management and would require some prescription medications. Oral surgery in particular, we would routinely use opioid prescriptions, but for very short periods of time.
Is there a fear that in some cases people will be so afraid of opioids that they'll have to endure pain that's unnecessary?
Yeah, I think the danger. I mean, the good news is that we're focusing on this crisis. The danger is that the pendulum can swing too far.
Right.
There is appropriate use of opioid medication, and I've had parents, I've had caregivers who refuse to give their or as patients refuse to take any pain medication and really suffer when it's not necessary. 1 or 2 days of proper and judicious use of opioid pain medications can really smooth the post-operative course. And our fear is that people will avoid seeking treatment if they don't think they will have any pain control afterwards.
Which is a good segue to my next question. Most parents, their first involvement in opioids is with a son or daughter that needs wisdom teeth pulled. And hearing everything about how that can lead to potential adverse situations, there's a lot of concern, in some cases fear. What advice would you give to parents whose son or daughter is going in to have the wisdom teeth taken out? What are some of the questions they should be asking the provider as well?
Look, it's on everybody's mind now, and I think parents have focused on this. Sometimes they've over-focused on it, but it's a concern. It's a concern with an adolescent group. I think the common analogy that is used, certainly in the press, is that that seems to be a very common first procedure where people that are addicts were exposed to pain medication for the first time. So the concern is, you have an adolescent. You do have a procedure that's necessary. It can be a little bit uncomfortable for 2 or 3 days afterwards. So we spend a lot of time now talking to the parents that withholding all medication is not a good idea.
Right.
We often will supplement it with some non-steroidal anti-inflammatories, but I generally advise parents that the first 48 hours it may be very necessary to use some opioid pain medication, and they should not let their child suffer needlessly.
That's great advice, and at Delta Dental we're trying to communicate with our brokers and our clients and our members about this issue. More can be done for sure. Talk a little bit about the alternative. You mentioned most people refer to them as NSAIDs, I believe.
Correct.
That's in many cases can be equally as effective?
Yeah, there are studies that show if you take, for instance, 800 milligrams of Motrin and combine that with some extra strength Tylenol and alternate those doses, it's as effective as Percocet in blind trials. So there is good evidence that non-steroidals in combination with Tylenol, if the patient is able to take those medications, not everyone can, but if they can, then that can often be as effective or more effective than Percocet.
I would assume that's great advice for parents and probably reassuring to many who would be happy to never have to use an opioid. We're all coming together pretty well on this. What are some of the things you'd like to see changed over the next few years so that we continue on this trajectory of even lower and lower opioid issues?
Well, you touched on it. The very few deaths nationally occur from prescription drugs, and in fact, a lot of those deaths may be intentional, so they may be suicides.
Right.
The majority of people that are dying are from the illegal drugs, which are unfortunately cheap and plentiful in this country. Unfortunately, in Massachusetts and in every state and every city and town in the country, heroin and fentanyl are readily available, and they're actually cheaper on the black market than illegal Percocet or Vicodin. So I think the prescription drugs is a good first step. I think we've educated the providers well, and that we've educated patients on how to use these drugs. But until we get a better handle on the amount of illegal drugs flowing onto our streets, it's going to be very difficult to eliminate all opioid deaths.
There's no question about that. David, thank you so much for coming here and informing all of us on some of the misconceptions about opioid and actually laying the groundwork for things we can do better, both as parents and as members of the community. I hope you enjoyed this, everybody out there on Facebook. I hope you'll join us in about a month. We'll be doing this every month. And again, my name is Dennis Leonard from Delta Dental of Massachusetts. Our series is entitled Pearls of Wisdom, and we'll be having more topics that impact the oral health community. Thank you very much for watching.
Thank you for having me.